There we go. Here we go. Knock, knock. Hello, my name's Sarah, and I'll be your nurse today. I'll be doing your assessment.
Good.
May I have your name, please?
Nick.
May I have your full name, please?
Nicholas Carlisle Shepard.
And may I have your date of birth, please?
June 19th, 1980.
Okay. Verify the patient's name and date of birth using two patient identifiers, as we have no medical record number. All right. Can I tell you? Can I have you tell me what brings you in today?
I'm here for an exam.
Very well. And may I have you tell me today's date?
Monday, the 25th. Monday the 25th.
And the year?
2019.
Okay. Very well.
That one I knew for sure.
Sometimes it's hard to keep up with what days of the week it is.
No problem.
Okay. And can you tell me where you are right now?
I'm at home.
Very well. And what are we doing right now?
An examination. Practice.
Okay. Excellent. Thank you. Patient is alert and oriented times 4, and have a Glasgow Coma scale of 15. Patient is doing purposeful movements, responding appropriately verbally, and maintaining eye contact. So all within normal limits. Very well. I'll get your vital signs. Do you have any specific cultural concerns
No.
with your care? Very well. And I have a blanket if you'd like to use it to drape yourself with.
I'll be okay.
Very well. Okay. And I will get your heart rate and respiration rate when I'm doing the cardiovascular or thoracic portion of the exam. If I may grab your temperature here, please. There we go. 98.3. Are you having any pain?
Nope.
Excellent. If you was reporting pain, I do a PQRST assessment, provocation, palliation, quality, region and radiation, severity, and timing of the pain. Okay. Thank you very much. And how would you prefer that I address you, sir?
Nick is fine.
Okay. Thank you very much, Nick. Better be addressing you as Nick. Okay. Just relax like normally. (144/88). Do you have a history of high blood pressure?
Nope.
Do you have any allergies?
Nope.
Any allergies to or sensitivities to food?
No.
Any sensitivities to latex?
Nope.
No known allergies, no known drug allergies. Okay, wonderful. And do you use any mobility aids? Any hearing aids?
Nope.
So you wear glasses. Were those full-time or just for reading?
Full time.
Very well. And when was your last eye exam?
Maybe 12 to 18 months ago.
Okay. Very well. And why don't we start off with the assessment of the head, ears, eyes, and neck. Do you have any issues with your hearing? Any drainage from your ears?
My hearing is not good.
Okay. Could you tell me a little bit more about that?
I have a lot of trouble with background noise. Usually trying clarity for speech.
Okay. Are you wearing? Do you wear an assistive device, a hearing aid, or anything like that?
Nope.
Okay. And I would use an otoscope at this time, but in my home I do not happen to have one. But I will inspect the ears again, since this is my home and my family member. I am not going to wear gloves. Should I be in a clinic setting or not with a family member, I would don gloves. Lucky you.
Should be fine.
Better be. Okay. Okay, no redness, no foreign bodies, no drainage. No drainage is best. And no obvious buildup of earwax. Okay, again, no lesions, no foreign bodies. If I was using an otoscope, I would expect to find the tympanic membrane, pearly gray, and the cone of light at 5 o'clock on the right, at 7 o'clock on the left. And you said no ear pain?
Yeah, I'm doing fine.
Wonderful. Okay, any problems with your nose?
No.
Any drainage, bloody nose?
Nope.
Sinus pain?
Nose is tip top.
Okay, wonderful. If I can look inside your nostrils, please. Just tilt back. Shade your eyes. Okay, nostrils patent, and again, no foreign bodies. Again, if I had otoscope, I would inspect the turbinates and expect to find no drainage, no edema, no swelling. And yes. All right. And may I have you take your glasses off, please? Okay. Feel your sinuses.
Right.
Tell me if you're having any tenderness. Very well. No tenderness? Okay. Excellent. So, sinus examination is normal. While we have your glasses off, like to inspect your eyes. So you wear glasses. Any issues with your eyes other than
Nope.
Needing vision correction?
Oh, doing fine.
No drainage, pain, blurry vision without.
Right. But nothing more than that.
Okay, excellent. If I can have you follow my finger with just your eyes.
All right.
Okay. Okay, wonderful. So all the cardinal movements are intact. 3 of the cranial nerves are intact. If I had remembered to get my cotton swabs, I would have also previously done this the smell test, which and I'd have him sniff 2 cotton swabs of different obvious scents, such as mint and coffee. Coffee.
I didn't recognize it.
No kidding. All right, if I could have you stare at my nose, I'm going to check your pupillary reflex. Okay. Pupils equal and reactive to light and accommodation. Yeah, let's get you your glasses back. Okay, any issues with your teeth?
Nope.
Okay. Sore throats, Bleeding gums?
No.
Mouth pain of any type?
Nope. Doing okay.
Okay, excellent. Tongue blade. Tongue blade. Okay, if I can look into your mouth. Okay, if I can have you say ah. Okay. And stick out your tongue. Okay, you may. So, excuse me. The 12th cranial nerve is intact. Tongue extends midline. Uvula raised. And uvula is midline. Midline. All right, if I can take a peek. And, okay, tonsils without exudate and a 2+. Thank you very much. And that. Tonsils 2+. Teeth intact. No presence of hardware. No broken chipped teeth. Oral hygiene good. Oh, good oral hygiene is best. All right. And I'd like to feel the pulses in your temples, so I'm just going to move your glasses just a little bit.
Good. Can you just take them off all the way?
Yeah. I'd forgotten to do that earlier.
That's fine.
Okay. Okay. Pulses 2+ bilaterally. And while I'm checking pulses, let's just go ahead and go for your carotid. Do one at a time here. Okay. Carotid pulse 2+ bilaterally and equal. And you may replace your glasses
Alright.
for now. And overall impression is the patient is in a pleasant mood, or at least faking it well, and good hygiene, dressed appropriately for home setting, and dressed appropriately for the weather. No apparent distress. All right. Now I'd like to feel your for your lymph nodes.
Okay.
And so far, visible hair appears to be equally distributed. Also have facial symmetry as well as symmetry throughout the rest of the body. A gross inspection at this time. So if I can have you turn that way just a little bit.
Like this?
Thank you. And on an adult, I should not feel them. Occipital, postauricular, periauricular, mandibular. Actually, while I'm here, I can have you open your jaw and close. Okay. So temporomandibular joint is 5+ strength. Okay. Can palpate a small lymph node on the right side submandibular. And submental. Okay, and then subclavicular. Okay, very well. Okay. I'd like to inspect your chest. May I have you remove your shirt?
Sure.
And again, hair distribution, equal and or symmetrical and expected for the male sex. Are you having any pain?
Nope.
Okay. And again, chest is symmetrical, no obvious deformities. Okay. Check your skin turgor here. One quick pinch. Okay. A sign that you're adequately hydrated. There is no tenting. Okay. Like to listen to your lungs. Do you have any difficulty breathing?
Nope.
Shortness of breath? How many pillows do you use at night?
Maybe one or half of one.
Okay. And also, do you have any skipping of the heartbeat, palpitations?
Nope.
Okay. Again, no edema. And vessel distribution normal. Okay, no obvious vessels. If I can have you take a deep breath. Again, please. Okay, and if I could have you turn that way. Thank you. Again, deep breath, please. Again. Okay, you may breathe normally. Respirations even and unlabored. And again, no apparent distress. And I will get the rate in a little bit. Cushion. Lung fields resonant posteriorly. Okay, you may turn to the front. And lung fields present anteriorly, yeah, they're present. Resonant. Okay. Like to listen to your heart. You may breathe normally.
Okay.
And I'm going to be listening in multiple fields. So pulmonic, aortic, Herb's point, tricuspid, and apical. Get your heart rate. 86 beats per minute. And again, breathe thoroughly. Okay. Respirations 14, even and unlabored. And again, the apical pulse, which I had stated earlier, I believe 76, was regular and no, regularly regular, no clicks, gallops, rubs, or murmurs. And respirations even unlabored, and the no use of accessory muscles for breathing. Okay, and upper extremities, no obvious deformities, and all skin is warm, pink, and dry, and with normal skin tone distribution and normal hair distribution. All right, let's move on to the abdomen. Yeah, that.
I'm playing along here at home.
If I could have you lay down, please. Ding for you. All right, yep. And rest your hands exactly like that. Are you having any pain?
Nope.
Okay. No abdominal tenderness? And are you having any nausea, vomiting?
Nope.
Okay. Okay. And overall assessment or gross assessment and inspection of the abdomen, it's symmetrical. And again, even hair distribution, a few striae on the lower portion of the abdomen that are a little on the older side, and absence of pulsations. So listen to all 4 quadrants. When was the last time you had a bowel movement?
Maybe an hour ago, 45 minutes ago.
Okay. Bowel sounds present in all 4 quadrants and normal active. Okay. Listen for bruits in the abdominal or arteries. And there is about a 5 centimeter scar on the right flank. How did you get that scar?
I had like little fatty growths, like pea or grape-sized growths that were below the skin.
Okay.
Kind of moved around a bit.
And there's also a 5 centimeter scar on the posterior right flank as well, which you cannot see at this time, but you can see when I was looking at your abdomen. I'm going to feel. Tell me if you're having any tenderness. Light palpitation. Okay, and there's a small movable 1 centimeter by ½ centimeter mobile mass, again superficial, on the right upper quadrant. Okay. And now I'm going to feel a little bit deeper and feel for the organs. Okay, again, tell me if you have any tenderness. This can sometimes be a little uncomfortable. Border of the liver. Not able to palpate the right kidney. Not palpating it is actually a good thing. Cannot palpate a full bladder, but there's sigmoid colon. Okay, and cannot palpate the spleen. That's, again, actually a good thing. And do a little bit of percussion. Okay, there's liver borders. Abdominal tympanic. Okay. If I may have you sit up. And while I've got your shirt off, if I can have you stand up, please. Turn to the side. And if I can have you turn around, actually. Thank you. Oh, actually, there you could have seen the scar. Oh well. Okay, so I'm looking at his spine, the curvature of his spine, and we have the double S curve, concave in the cervical region, convex in the thoracic region. Okay, here, I'll move my hand up back a little bit. Convex in thoracic, concave in lumbar, convex in the sacral area. And everything is midline, and there's some shoulders are symmetrical, showing no sign of scoliosis. May I have you touch your toes, sir? Nick. Okay, and again, everything is within nicely in line. You may. Thank you. All right. And I think you can put your shirt back on if you like. Buried under here. And I'll check your strength of your head, neck, arms, and the like. Yes, you may have a seat. While I'm thinking of it, let's go ahead and check sensation. Okay, this is soft, and this is dull.
Good.
So if I can have you close your eyes, I'm going to be touching your face, then your arms, and then I'll get your legs here in a moment. So tell me what you feel.
Soft. Dull. Soft. Dull. Dull.
Close your eyes, dude.
Sorry. Soft. Soft. Dull. Soft.
And going to do the same thing for your legs. There you go.
Soft. Dull. Dull. Soft.
Excellent. Pull your pant legs back down for the moment. And, okay, ever so slight trace edema appears on the lower extremity of the right foot, and none apparent on the left. Okay, let's go ahead and get your radial pulses. Radial pulses 2+ equal bilaterally. And while I'm here, okay. Yeah, thank you. Move your feet out just a little bit. Thank you. A little bit more. There we go. There it is. All right. There you are. 2+ equal bilaterally palpatile pulses. And PT pulses. Here, I'll move so the camera can see me. Yeah, you can actually see me. Two plus equal bilaterally for PT pulses, dorsalis pedis, two plus equal bilaterally. Okay. And again, 1+ edema today on the right leg and the left leg. He thinks you were sitting a lot today.
I was.
Knowing your day. You've done. Okay. So let's check your strength. Okay. I'd like you to turn your head against my hand.
Good.
Okay, excellent. 5+ strength, and then again, 5+ strength with the neck. Against your shoulders, shrug your shoulders. Okay, 5+ strength bilaterally, and bring your fists up like this. Yep, not actually gonna box me. Pull against. Okay, and then push. 5+ strength bilaterally upper extremities. And then we're going to have you pull your knees, or pull your feet, yep, and push. Excellent, 5+. And then we're going to do the same thing with your ankles. Pull against my hands and push. Okay, 5+ strength bilaterally for low extremities and ankles. Okay, so let's check out range of motion, which I am lacking today. All right. If I can have you go ahead and stand up, Nick. Thank you. Okay. Okay. So let's have you turn your head to the right and to the left. Okay, so we've got neck rotation, flexion, chin to your chest. I think you can all see it on the camera. And then extend or hyperextend. And then we're going to do lateral bending to the right, ear to your shoulder, and then to your left. All right, we got all those. So range of motion, full range of motion of the neck. And we're going to do the shoulders. Hands up to here, flexion of the shoulders, hyperextension, abduction, adduction, internal rotation, external rotation. And let's go to the elbows. So flexion, extension, supination, pronation. Wrists, ulnar and radial deviation, ulnar and radial deviation, flexion. I'm sorry, that was extension. Extension, flexion. And then with the fingers, flex, extend, abduct, adduct. And while I've got your fingers, we'll look at the nail beds. Thank you. And nails are smooth. Nail beds are firm. No brittleness. So far, brisk cap refill bilaterally. All right. And let's see, we checked flexion of the spine. We did not check extension. So if I can have you bend as far back as you can with your spine, very well. That's awesome. And then twist to the side and to the other side. So full range of motion of your spine. Right, let's go with the hips. So flexion, extension. Okay, why don't we turn this way so you don't kick the credenza, because your mother would kill you. All right, there we go. The other leg. Flexion, extension, abduction, adduction, abduction, adduction.
Right.
And internal rotation, again, that starts, thank you for not turning out at your knee. Adduction, or sorry, internal rotation, external rotation, and then on the other side, internal and external. Yeah, again with the thigh and not your knee or ankle. There you go. Full range of motion of the hips. And knee flexion, knee extension. And then while we got you up there, plantar flexion, dorsiflexion. Spread your toes, abduction. All right, crunch them together, adduction. All right, very well, and do the same on the other side. Flexion, dorsiflexion, ab, and add. Excellent. So full range of motion of lower extremities. You may have a seat for now. Look at your nail beds of your feet. So the only deformity on the lower extremity is slight syndactyly of the second and third toe on the right foot and a chipped great toenail. And yeah, these are nice and pink. All skin is pink, warm, and dry. And we've got bricks cap refill. And on the left foot, there is a slight excoriation on the dorsal side. And yes, I was not prompted with that, but there is a slight excoriation on the medial malleus on the left side. How did you get those little those little scratches?
I scratched them myself. I just have dry skin on my ankles.
Okay. Very well. Okay, so moving on to neurological exam. So level of orientation we already went through, alert oriented ×4. And let's see, we are deferring the first cranial nerve, second cranial nerve, optic nerve. You were following my fingers, and so you could obviously see my fingers, but we would also check the optic nerve by the Snellen chart, which I do not have here. But the movement, that's cranial nerves number 3, 4, and 6. So those are intact bilaterally. Vagus nerve, we already checked as well. 5, 6, 7. Facial nerve, give me a smile, give me a frown, puff out your cheeks. All right, very well. So facial nerve is intact. Acoustic nerve, please repeat what I whisper in your ear.
Okay. Red. Dwarf.
Yes. Had to. So cranial nerve number 8 is intact. Okay. Number 9 and 10, we checked with tongue blade, the uvula raising, and I'd also do a gag test with the tongue blade, which I'm not going to do. Spinal accessory nerve, you can shrug your shoulders, that's bilaterally intact. And then mentioned 12th cranial nerve, hypoglossal, tongue's midline. So all 12 cranial nerves are intact. And let's see. And I'm going to have you stand up again. And if I could have you walk normally from here, there, and then turn around. Okay. Arm swing is normal, gait normal and steady. And if I can have you, again, walk, but we're going to have you walk like you're walking on a balance beam, heel to toe.
Okay.
Checking cerebellar function, and that is intact. And now that you're standing again, if I can have you close your eyes and just stand there. So negative Romberg, there is no leaning. You may open your eyes again. And if I can have you sit down, I'm going to check your patellar reflexes.
Okay.
Yep, scoot just a little bit. Actually, I want your knees to be dangling, or your legs to be dangling just a little bit. There we go. Okay. There we go. And deep tendon reflexes, deep tendon patellar reflexes are 2+ and intact. And I believe that concludes our assessment. Do you have any questions, concerns for me?
No.
Okay, very well. Is there anything you need?
Okay.
Very well. Were this in a hospital setting, I would return the bed to a low position and make certain call light is in reach and make certain curtain is draped appropriately, thigh rail up, and the like. Again, thank you very much, Nick, for being my guinea pig patient. And yeah, I think that's it.